Just going to take an overall look at this prioritization form that's used by the California Department of Consumer Affairs. It's to help different agencies rate and determine how severe a category an issue might fall into. So I'll just zoom in on a few things. So here we go with category 1, it's urgent. We're talking about acts of serious nature that cause great bodily harm or death. Impairment of the licensee, in this case would be talking about dentists, and working under the influence of alcohol or drugs. That wouldn't apply to someone who's had a wild weekend and then goes to work sober. There are many professionals with addictions that need to be handled properly. And it also discusses repeated allegations of drug or alcohol abuse. Next category is, I guess this is still category 1, urgent. We're talking about thefts of narcotics, possession of illegal drugs, misconduct, sexual misconduct with a patient, physical, mental abuse of a patient, overprescribing, gross negligence or incompetence resulting in harm or injury. And in that situation, I would probably put the idea of using an inappropriate approach, perhaps overtreatment would fall into this category. Full mouth crowns and veneers, for example, for headache treatment might be an example of this. It says something to do with media politically sensitive cases. I'm not sure how that would apply to dentistry. Category 2 is high priority. We're talking about just prescribing without authority. So again, dentists have the authority to prescribe things that relate to dentistry, unless it's probably an emergency. Unlicensed practice. This could fall, I suppose, if there's, for example, mail order dentistry being done, or a dentist from another country who's practicing without a license. Perhaps a dental office that's hiring people they know don't have the right licenses. Criminal violations, including forgery, issues with examinations, mandatory peer review reporting. Not sure if that would mean that if you didn't report someone that you knew was causing a problem. Dropping down to category 3, and let's see, we're going into general unprofessional conduct where there's no injury. Rest. Not familiar with this term here, that at least exams. Medical malpractice reporting. Look that one up. Serving subpoenas for hearings. Patient abandonment is again considered a routine issue. So a patient might have a problem and they expect you to take care of it unless you've actually formally dismissed them, and even then it's usually giving them 30 days notice, but there's probably all kinds of different situations there. Under routine category is false and misleading advertising, which is not related to to actually unlicensed dentists, for example. This would relate to, for example, questions about the guidelines relating to truth in advertising and making claims that might be tough to substantiate, and this is a big topic in Alberta, Canada, and it's something to do with applications of dentists who've had misconduct. Under Category 4, another lower level routine, to talk about unsanitary conditions, and again, this is from the California Guide, state of California, but in a dental office I would be putting unsanitary conditions at a higher level. For example, if sterilization, basic sterilization procedures weren't being done, that would obviously be an urgent concern. If you're holding back records that are being requested, that is considered a routine, but some dentists think that they can not share the records if the patient hasn't paid for them yet, but that's not appropriate. And record keeping violations are another common error that dentists may not properly keep records of every detail. Continuing education violations, this is again perhaps hours of education might not be met, but this is a debatable subject. I would argue that there are continuing education courses that are actually better not to take than to have hundreds of hours of incorrect training. This has not been addressed properly, at least in Alberta. Let's see, there's offensive behavior, poor bedside manner. I mean, there's always going to be situations where a dentist doesn't get along with somebody, or the patient isn't a good match for the particular dentist, and that might result in a complaint. Quality of service complaints, they might think that your crown filling or whatever could be improved, and that's usually fairly easy to change. Now, if the dentist's on probation and they have further problems, that would actually add to the issue. And I guess that's about it as far as what we can discuss with related to Alberta. So again, this is a reference with the California Department of Consumer Affairs, and we are challenging the Alberta Dental Association and college to provide their own guidelines, since according to our own research, the complaints department is wasting hundreds of thousands of dollars on remedial issues and bullying decent professionals over minor disagreements in advertising. And it's time to get serious and talk about what is actually urgent. And there are patients with serious overtreatment, for example, that are being neglected, and wait times for complaints are unacceptable. It's time for a complete audit of the complaints department.